And, you know, I do have to hold on.
Yes, I want you to hold on. Absolutely.
So what we're going to do is do a reset on the communication between your brain, which we're working on your left knee. So it's the right side of your brain that sends the power down to these areas here. And we're going to get your knee and your brain to start communicating again. Okay? So you're going to take that deep breath. And if you need me to stop, just say the word stop, and I will stop right away, and we can regroup and go again. Just try to work through it the best that you can, okay?
Okay.
All right, so take a deep breath, and pull your knee up. Good, 1, 2, keep going, pull that knee up to your chest, 3, keep pulling, 3, 4, 5, 6, 7, good job.
This is going to be easier. This
Wow.
is definitely easier.
Definitely easier going down.
In one 30-minute treatment.
One 30-minute treatment. So what was your discomfort level? It was 6 when we started. What do you think it is now?
It's a 1.
And you know, Laurie, I just want to point out to you right now, when I watched you come down the stairs, you only used 1 foot per step instead of 2 when you originally started.
I know, I could not.
So now you can go down the stairs tandemly. And it's because the mind, your brain, is now letting you walk down the stairs tandemly. And you didn't even have to think about it.
Amazing.
You didn't even have to think about it.
Oh my
We haven't even done therapies. I told you we're going to make you a new woman today.
I know.